I shouldn't eat soy foods or drinks if I have breast cancer. Oh my God, I got this question a lot from my patients in clinic. Hi, my name is Dr. Nur Fadhlina Satar, or better known as Dr. Nina. I'm a consultant clinical oncologist at Pantai Hospital, Kuala Lumpur. Breast cancer is the #1 most prevalent cancer in Malaysia amongst women. So there are some myths about breast cancer that we need to debunk. Let's do that together. Breast cancer only affects women. This is not true. Remember, man has chest too, and they have breasts, so they can too get breast cancer. However, this is rare. Only 1 in 1,000 men get breast cancer. Compare the statistics to Malaysian women, 1 in 20 women get breast cancer. The reason why men can get breast cancer is what we call genetic predisposition or family history. So if you're a man, be sure to know your family history and get yourself checked out. I won't get breast cancer because no one in my family has it. Not true. While having a family history does increase your risk of breast cancer, like I said before, less than 10% of patients with family history get breast cancer. That means about 90% of my patients that I see in my clinic get breast cancer without family history. Other factors that can cause increased risk of breast cancer include age and lifestyle factors. Eating sugar makes my cancer grow faster. Clearly, this is not true. At the end of the day, your body is made of complex metabolism pathway and you need sugar to fight your cancer. If you're unsure, get advice from your friendly dietitian or nutritionist. Doing regular juice cleanses reduces the risk of breast cancer. Remember, there is no scientific evidence that doing regular juice cleanses reduce the risk of breast cancer. Even though juice cleanses have many health benefits, honestly, I feel the best way to get it is by eating whole fruits and whole vegetables. I shouldn't eat soy foods or drinks if I have breast cancer. Oh my God, I got this question a lot from my patients in clinic. So there are a lot of aunties, uncles out there that advise you against soy products. So cannot eat soy milk, cannot eat soy sauce. So let's debunk that myth. Honestly, whole soy food, for example, tofu or tempeh or edamame are good for you. There are research that shows that they actually reduce the risk of breast cancer. What's really the issue behind soy? Soy contains isoflavones or phytoestrogen. Although they mimic the estrogen in the body, they do not actually cause the cancer to come back or increase the risk of recurrence of breast cancer, so to speak. So there you go, eat your soy food. Wearing underwire bras can cause breast cancer. What's the thought process here? So the thought is underwire bras can cause reduction in circulation or cause too much pressure and maybe cause blood clot and lump to form in your breast. Breast cancer are not lumps due to clots. So breast cancers are mutated breast tissue. And there's no study that shows wearing underwire bras can cause this. So you can safely wear your bra, whichever way you like it. Only older women need to do mammograms. So we know that breast cancer risk increases in the older woman from 55 to 75 years old, and hence mammogram screening is recommended for this woman. I do see a lot of young women coming to my clinic with breast cancer nowadays. The most important thing to do is to be breast aware. Do monthly self-breast examination. Furthermore, you can get yourself checked up in clinics. And if you are young and have a dense breast, you might be recommended to do breast ultrasound on top of your mammogram. If you have a strong family history of breast cancer and you're young, then it's always advisable for you to check with your healthcare professionals in terms of the frequency of the screening that you should go for. A mastectomy is the best treatment for breast cancer and removes it entirely. Although when we remove the whole breast tissue during a mastectomy, it reduces the risk of breast cancer, this does not mean that the breast cancer will not come back, full stop. Breast cancer can still recur in chest wall, or in distant part of your body. Breast conserving surgery or a lumpectomy is also a treatment for breast cancer and can be highly recommended because it's less disfiguring. So some women do not want to come and have their breast cancer treatment because a mastectomy can be very disfiguring. Therefore, now there are more newer approaches in terms of giving chemotherapy upfront to reduce or shrink down the tumor so that many more women can have breast conserving surgery and keep their breasts. So even if you do have to have a mastectomy as a treatment for your breast cancer, worry not, because you can still discuss with your breast surgeon in terms of having immediate breast reconstruction. Your body does not have to be completely disfigured by breast cancer treatment. Chemotherapy is a must for breast cancer treatment. Although chemotherapy reduces the risk of breast cancer coming up or coming back, we must know that there are a lot of different treatment options available out there. And remember that your breast cancer has many different varieties. There's hormone-positive breast cancer, there's HER2-positive breast cancer, and triple-negative breast cancer. Although chemotherapy can remain as a backbone for some of this breast cancer, we do know that there's targeted treatment and immunotherapy that can be coupled with chemotherapy. Furthermore, for hormone-positive breast cancer, we don't necessarily need chemotherapy for all women with hormone-positive breast cancer. At the end of the day, women should be empowered to make a joint and shared decision together with their healthcare professionals. Most side effects from chemotherapy are temporary. You do get hair loss, but your hair will grow again. And you do get some tiredness, especially in the first few days of chemotherapy, but your energy will come back. So remember, you can remain fit and healthy through your treatment. It's unsafe to have sex during cancer treatment. So number one, you cannot transfer your cancer from one person to another. So it's not an infectious disease. So that's number one to remember. When you're having cancer treatment, it's true that your sex drive might be affected. At the end of the day, listen to your body and have an open conversation with your partner regarding this. Remember that with some cancer treatment, we advise for you not to get pregnant during them. So that's another thing to put into the equation. But the truth is, you can have sex during your treatment and it's safe. So that's all the time we have to debunk the myth of breast cancer and its treatment. If you have any questions to ask or you would like to discuss some points with me, please feel free to make an appointment with me in Pantai Hospital, Kuala Lumpur.